You're watching Hindustan Times and I am Aditi Prasad. The lockdown, which was supposed to end on April the 14th, is most likely going to be extended. According to the sources in the central government, we've been informed that the lockdown may be extended till the end of the month, which is the 30th of April. Now, India is roughly at the same point in its coronavirus or Covid-19 curve that the US was barely a few weeks ago. The number of cases, the number of positive cases, the number of deaths are almost similar as US was about 2 weeks ago. But since then, US lost all control. Now, the next couple of weeks are going to determine whether India will go the United States way or whether or not India can flatten the curve just like South Korea has done. Meanwhile, the Bhilwara model seems to be emerging as a favorite to stop the spread of COVID-19 in various states across the country, in various districts across the country. Union Cabinet Secretary Rajiv Gauba, who's at the helm of affairs in sort of battling this scourge across the country, in fact went ahead and told a meeting of the state representatives that the Bhilwara model should be adopted by them in various districts where conditions are conducive to adopting the model. So what exactly is the Bhilwara model? First, we must understand for that what actually happened in Bhilwara. The first case of COVID-19 in Bhilwara came into being, it started at a private hospital. There was a doctor who got infected and through him it sort of transmitted to various patients and to various medical personnel and staff within the hospital. The Bhilwara administration, of course, immediately swung into action and took these 5 steps, which I'm going to outline in the next few minutes, to sort of control the spread of the disease in that particular district. At this point, let me just rewind a little. On March 18th, Bhilwara had 0 positive cases of COVID-19. On March 30th, there were 26 positive COVID-19 cases. Bhilwara actually appeared on the 26th of March to be on the cusp of a large-scale outbreak. But then came the ruthless containment from the Bhilwara district administration. In the last 1 week, only one COVID positive patient has been reported from that entire district. Let me take you through the 5 steps that the Bhilwara district administration took in order to stem or to stop this outbreak in the particular area. Number 1, isolating the epicenter. As I told you before, the first reported case of coronavirus in Bhilwara was of a doctor at a private hospital who tested positive. Now, the Bhilwara administration immediately sealed the hospital and the concerned medical staff was put in isolation. Secondly, they isolated the district. Curfew was imposed in the district on day 1 that the case was reported. This was from March 20th to April 2. Borders were sealed, but essential services were allowed to continue. Then came the ruthless containment. The district administration defined the containment zone of 1 kilometer from the private hospital, which was the epicenter, and a buffer zone of 3 kilometers around that. Similar containment zones were also created around the houses of each of the COVID-19 patients. Mass screening came next. More than 6,50,000 homes and 24 lakh people were screened in urban and rural Bhilwara. Disinfection of containment and buffer zones and the locality of positive cases was done every single day. And finally, the most stringent curfew was placed after April 2nd, which is April 3rd onwards. Lockdown restrictions have been tightened to curfew-like isolation and even stores selling essential commodities are now shut down. Only home delivery of essentials is currently allowed. Now, according to the Union Health Ministry, over 80% of the total positive cases have been traced to 62 districts across the country. The government is reportedly mulling implementing the Bhilwara model in all these districts to sort of contain the spread of the virus. Will it reap results? We don't know. But clearly, ruthless containment is the only way forward.